Tony's a better if I stand over here.
Yeah.
Your video. So my name is Rod Kirkham. I'm an independent broker in health insurance, primarily Medicare. I'm affiliated with another group of brokers. We operate under the name Medicare Resource Center. The actual brokerage is United Christian Advisors. We've got a storefront location on the ground floor of One Elizabeth Place, so the old St. E's Hospital. It's walk-in. We offer a lot of services to Medicare beneficiaries there, starting with if somebody needs to get signed up for Medicare, they don't have it yet, but they're turning 65, we can assist them with that. We frequently assist people with making application for a program that's it's overseen by Social Security. It really gets administered through the state Medicaid system called Extra Help with Prescription Drugs. And that's a program where people with a Medicare Part D program can get a significant reduction in their out-of-pocket co-pays or co-insurances depending on their income. And it's about, for a single person, the income limit's about $18,000 a year and $13,000 of resources. So that's not owning a home or a car, but it's money in the bank or a little IRA that's left behind in a former employer or something like that. So if they're below that, they get significant help. It'll drop their co-pays depending on their level of extra help to, I'd be $1 for generic and $3 for brand new drug. In Dayton or in Montgomery County, I think the stat is 1 out of 4 people who are on Medicare qualify for this extra help benefit, and the vast majority are not signed up for it. You automatically get enrolled in it by Social Security if they can tell from the earnings data, which they extract from IRS databases. If they can tell that you're qualified for a Medicaid benefit, they'll automatically connect you to extra help. Everybody else, you get a letter as you turn 65. If anybody's been through that process recently, you know your mail stacks up like this. So that letter gets lost in the shuffle. The other place, that's a one-time notification. The other place people get notified is if you take the time to read the annual Medicare and You book that Medicare sends out in the fall. About 2/3 of the way back, there's a little paragraph that describes the extra help benefit and tells you, if you're not sure if you qualify and you want to try to sign up, call Social Security or, go to the website. So we do that work. We make application for people. If they're granted extra help, then it gives them a continuing open enrollment period where they can change their plan year-round. So if they're not in the Medicare Advantage plan, they can get in one. If they're not in one that is meeting their needs and they want to look for something else, we help with that. As independent brokers, we're agnostic as to what plan they're in. So it doesn't matter to us. Anthem, Aetna, Humana used to have a Premier Health plan. So it was removed from the market. United Healthcare, Medical Mutual of Ohio. We're looking at a couple of the smaller carriers for this fall. We do not work with CareSource Medicare Advantage plans because they do not work with brokers. So it's all 1-800 to them or do it yourself on the Medicare website. So we see a great need. There's, a communication need, an education need, in the community to help people access the services and the resources that they need. We get a lot of walk-in traffic in our Elizabeth Place office with people looking for how can I find me a primary care doc. Normally if they're in a plan, there's some assistance the plan can give. We may refer them to a physician finder service at Miami Valley Hospital or Kettering, where they say they'd like to access a hospital-based service. A lot of people we see are accessing at least part of their services, right in that facility of the old St. E's Hospital. to seek cardiology services, or maybe it's a mental health service. So it was very enlightening to hear what Five Rivers does today to me, because I'm 7 years in this business working with Medicare clients, and I didn't know Five Rivers existed until about a year ago, when I was working with a client that had a bad enrollment experience with a captive agent from a major insurance company and needed a better solution, and it's like, why go to Five Rivers? And that was the beginning of my knowledge learning curve on what Five Rivers can do for folks. When I sit down, I'll pass around the sheet. Don't take time to read it from the meeting, but I brought a copy of an article that was in Wednesday's Wall Street Journal about drug costs, the role of PBMs,
What's PBM?
pharmacy benefit managers. So most plans don't go sign up directly with pharmacies to provide them drug benefit. They employ a middleman called PBM, pharmacy benefit manager. They in turn negotiate drug pricing with either directly with pharmaceutical manufacturers, or in other cases maybe they're negotiating that with a drug distributor like Cardinal Health or like McKesson. So that's really where the pricing gets set, and then the cost gets passed on to the insurance company. A local pharmacy gets squeezed, and that's what the article's about. And there's some examples from right here in Dayton, pharmacies that have been forced to sell out to CVS in the last year because the reimbursement rates had been reduced below their quote wholesale cost of the drug.
That's sad.
So
That's not a good thing? I mean, didn't we have just too many pharmacies? That is a good thing?
Well,
That is not.
I guess it depends on where you live. You know, if you live close to CVS on West 3rd, that's okay to go there. But if you live further out in Northwest Dayton and you're not close to CVS or you're not close to a Walgreens, it's not a good thing.
I just remember when that little spell of time when they were putting a pharmacy on every corner.
Yeah.
That just seemed like overkill.
You know, I have a lot of clients who much prefer going to their local independent neighborhood pharmacy for their drugs than they do big box, whether it's CVS or Walgreens, or maybe it's Kroger, or maybe it's Meijer. They want to go to the local independent guy. I have a client who's on a tight budget, not quite qualified for that extra health benefit, and she's got a list of medicines like this. Some of them are branded, or they're expensive generics, so they're in tier 3. That means they're $45 a month. And so her drug spending does this. She uses a little pharmacy out in Springfield, where she's originally from, because they'll run an open account for her. So she fills her drugs, picks them up, she pays for what she can, they carry the balance. Later in the month, when Social Security hits, she goes in and pays them off. She can't do that at any big box. And she can't do that with the mail order benefit that attaches to her Medicare Advantage plan. So
I use a local pharmacy. They have 3 pharmacies, one in Trotwood, one in Kettering and Oakwood, right there on Far Hills, and one on Alex Bell. And his prices actually are sometimes better than CVS or Walgreens. Because he does an analysis of the different drugs and what they cost at the different places. And I was surprised that his actually was $5 lower on Xarelto.
yeah, there's a lot of variance in drug costs.
Right.
When we do analyses, there's a drug research tool on Medicare.gov that as brokers we use a lot, because then we can look across multiple plans and see what plans can deliver the lowest net out-of-pocket cost in a year for a client. So we are able to determine, are all the meds on formulary, then we look at the cost. Sometimes, if you can plug 2 pharmacies in at a time is all, which we'd like to see more, but sometimes it's fine because the client says, I'm only going to go here, or I'm only going to go between, one of these two. Sometimes the price is exactly the same. Other times it's dramatically different. And it all has to do with, are they a preferred pharmacy or just a network pharmacy with a given carrier? And then what kind of, pricing contract they have via the PBM for that carrier.
With PBMs, everybody know how those work because we also have a contract with 2 big PBMs. And so I went to a lot of research on pharmacy benefit managers and why there's a difference. What they do is they actually go out, like he said, they go out and contract the price. But people say, well, that drug from the drug manufacturer, just say it's $50. But then maybe they have rebates or something, but I'm going to say that Ralph has a company and he goes and he says, okay, I'm going to pay me to manage that drug program. So Ralph's going to pay $100 for that drug, but the manufacturer supplies it through the PBM. And they may say, well, we normally sell this for $50, but we're going to have a $40 rebate on that. The PBM keeps that $40, still charges Ralph the $100. And that's why PBMs, if you look at them, they're a $300 billion a year profit company that's completely unregulated. And that's why there's a difference. I'll give you an example. I don't take any, I'm pretty lucky. My mom just passed away this year. She's 98. She never took any prescriptions at all. So I don't know. I've never taken any. My wife, we're very fortunate. We don't have to take anything. But my dog does. And since we have these prescription discount drug cards, as part of our company, my dog, she's a King Charles Spaniel, so she's so old, she has an incontinence problem. Well, I can't get this drug at the vet, but being in the PBM world, I know I can use my discount drug card. I go to a Kroger's, that drug for my dog is $530 every 3 months for my dog. My wife says, that dog's awful expensive, and I want to keep my dog. And I use my prescription drug card that I have. I pay $109 for it. It's the same drug. If I use my insurance, it's I can't use it on my dog, obviously. But if I go to buy that through an insurance, it's $531. I'm paying $109 for the exact same drug at the exact same pharmacy. And he was talking about pharmacies, and Tony was. He's right. You can go to Kroger's and buy a drug that's $50. You go to Myers, it might be $48. You go to CVS, it might be $115. You might go to an independent pharmacy, and he might be $48 also. Every company has different prices, and then they differentiate that price through the insurance company, as he was talking, preferred providers, in-network providers, and they have all these tables and formularies that they use to determine what people pay. And a lot of times, I know on ours, because I just see the numbers and mathematician, our average savings is 58% on a drug off the price if you just go buy it off the shelf. And sometimes it's really crazy. You can go pay $130 at Myers. Had a customer in Michigan said, I went and bought this for $26 with my drug card, and through my insurance, it was $129 or something like that at a Myers. And you don't know. That's why people get upset with drugs.
Do you have a Wi-Fi signal? If I give you one, would you do it? Do you have Wi-Fi on this computer?
It's an old computer.
These pharmacies are good, yeah.
I'll comment on 2 more things and sit down and let Tony take the discussion where he wants. Who in the room has heard of a service, website, app for smartphones called GoodRx.com? I'm sure Chuck has.
Yeah.
Okay, so this is basically another version of what his company's discount drug card will do. I belong to the Springboro Chamber of Commerce. They have one of their own. GoodRx it's a public-facing tool. You can use it to find the lowest price near you for generic drugs. So I just plugged in celecoxib, which is generic Celebrex, all right? And from here, the lowest price currently for 30 capsules, 200 milligrams is $18.70 at Meijer. If you hit the coupon button, it'll give you a coupon you can print off at home, or if you've got a smartphone, you just show that to the pharmacy staff when you go in. It's got all the codes. got the RX bin and all that stuff that they need that actually sets the pricing in the computer systems that tie back into the PBMs. But if I look at, what are the prices elsewhere? Well, it's $22 at Costco, $21.93 at Kroger, $39.97 at CVS with the discount coupon, $23.47 at Walgreens, and so on. Now, let's see, if you go to a Rite Aid, it's $84.98.
$84.98?
So there's an example. A couple of years ago, I enrolled over the phone. I do some work with the Affordable Care Act too, or AKA Obamacare. By the way, keep your eye on the newspaper as the fall enrolls and fall approaches, and we'll see if we even have that in the Dayton area anymore. This year, we're down to 3 carriers: Molina, Ambetter, which is Centene Corporation out of St. Louis, and CareSource. And they all have their Affordable Care Act plan riding on the back of a state-managed Medicaid network. And you can't go to Premier, you can't go to Miami Valley, you can't go to Good Sam if you're in one of those plans, because Kettering's the only hospital provider they have. And we'll see if they even stay in business this year. I don't know.
That's
Affordable Care Act here.
Affordable Care Act.
Yep. All the other major carriers have left. First one out was Aetna, followed closely by United Healthcare, then followed this past year by
Premier.
Humana and Anthem and Premier. And Medical Mutual has pulled back to where they just have a cluster, small clusterings of counties where they've got a very narrow network with Mercy Health. So GoodRx, make yourselves familiar with it. Get one of Chuck's cards. You can go to the counter and say, which one's best? If his is best, use it.
That's exactly what we
And if GoodRx is best, use it. Sometimes, I talk to every one of my Medicare clients about this and say, usually, if you're on a generic, your Advantage plan copay is going to be best, but it's not guaranteed. Or if you're in a plan that has a big annual deductible that applies across all your tiers, and all you takes generics, you might be ahead of the game just doing this, because against the deductible, they'll pay the full cost of that drug. Last thought, back to PBMs. Who remembers when Medco was a standalone PBM? Maybe not, because they were a pretty small one. And this is back in the mid-90s. They got acquired by Merck. So then they went into market as they were Merck Medco. And I remember, reading with anticipation, the financial press was saying, this is really going to be great for Merck, because they've got this PBM, and they're going to have their in the field physician-facing sales staff in talking to doctors about, well, you got your patient on this cardiovascular drug, but we got one in the same drug class, switch them to this, and run it through Medco. And that's exactly what they did. And about 10 years in, then, the public became aware of that, the government became aware of that, they started looking at what's happening to drug prices and reimbursements. All of a sudden, Merck was taking a ton of heat about what was happening with their Medco PBM. They put it up for sale and sold it to Express Scripts. So, there's